Hi guys, this is John Adamson, the Rehab and Documentation Guru, filming with the background of the Richmond International Airport, hoping that this doesn't affect the quality too much. Plus I got different headphones, so hopefully these are picking up well. Anyway, I'm responding to a message I got via LinkedIn from Charles, and it was a request to address repetitive services and maintenance therapy. And it's a really good logical question. So if you've got somebody that's on maintenance therapy for a long time, wouldn't care of a maintenance patient necessarily be repetitive? And it could be, there could be some repetition to it, but I want to take you on a journey briefly to the definition of what skilled services are. So skilled services are of such complexity that only you could safely and effectively do them. With that said, complexity is further elaborated upon to indicate the complexity of the patient, and we see these in the the CPT codes for evaluation, including low, moderate, and high complexity evaluation. And when you think of a patient that is on maintenance therapy, I want you to think of the highest complexity clinical presentation being unstable. So seeing patients that are unstable in their clinical presentation makes it extremely hard to turn them over to a non-skilled person because of their instability. One thing that Charles mentioned was vital signs. Well, if they've got bad blood pressure, but it's a fairly stable presentation, in other words, we exercise them, their pressure goes into an unsafe range, and we stop the exercise. If we can figure out at what point pushing them would bring that blood pressure to an unsafe range, then we can just simply modify how they do their activities and keep them within that safe range pretty much consistently. So there are people that respond in a fairly stable or evolving clinical presentation way with vital signs that after a while you can see there's an established baseline with activity and rest, and you can predict pretty much how they're going to respond every single time, and that would make them probably fairly safe, going back to the other word of medical necessity, to turn over to a non-therapist for effective, there's that other word, treatment or doing exercise programs. So when you think of maintenance patients, think of unstable clinical presentations, people that have vital signs that are all over the place, and you don't know from one visit to the next what you're going to get with that person. Therefore, that makes each and every single visit skilled, because you're going to have to modify, you're going to have to adapt, you're going to have to adjust what you're doing with the patient based on their clinical presentation that day. And that's what makes a patient more likely to be skillable from a maintenance case. Not just because they have a progressive disorder or because their vital signs get out of whack. Think about the instability. What am I going to see today? If you can go into a patient's house or see them for a visit and know pretty much off the bat, before you even lay eyes on them or touch them, what they're going to present as, and they do indeed present as that picture in your mind, then they're probably not unstable. And if they're that predictable, then they're probably not a maintenance therapy case. So anyway, Charles, that's how I would deal with that. With a maintenance case, over time, you're going to see a lot of variability, even between visits, and that's going to require skill. Anyway, this has been John Adamson, the Rehab and Documentation Guru, hoping that helped Charles and anybody else that has that question. Take care, and God bless.